So, you are from?
I am from basically Mumbai,
Basically from Mumbai,
working in Saudi Arabia.
working in Saudi Arabia.
Yeah.
So, could you just briefly tell me your story? How did you come to know about this surgery, and how did you find us, and what kind of motivated you to come here all the way?
Basically, actually, my gaining weight was giving me a lot of issues in my life, like knee pain,
Right.
unable to walk, and in my daily activities, I used to face lot of difficulties.
What was your maximum weight?
My maximum weight was around 178.
178. That's when you
That's
came
when
here
I came
on
here.
the day
yeah,
of surgery.
yeah.
Right.
And
Okay.
I was opting for surgery when I was 160.
Okay.
Because as my weight used to go above 160, I used to have pain, knee
Right.
pains.
Right.
Okay, I tried various dietings, walking and all, but I was merely, in fact, I used to increase weight.
Okay. Right.
Really, I'm not.
Even with dieting,
yeah,
it did not come
Not
down.
come down, yeah.
Yeah, but we see many patients who would
Yeah.
decrease like 30 kilos, 50
Yeah.
kilos with dieting.
Yep.
But again, the story is the
Yeah,
same.
like in
again,
Ramadan
it will come
fasting.
back.
In
Yeah.
Ramadan fasting, we used to fast whole month.
But your
I
weight
used
would
to
not
look,
come down.
weight will come 10 kg,
Right.
and then after Ramadan, it will
Yes.
reduce more
Yes.
30 kgs.
Yeah, that's what everybody tells me.
Yes, this is the body
Yeah.
chemistry, you can't help it.
Okay, then how did you decide?
Then
finally?
I was looking on internet for various options for how I can lose weight. Okay,
Right.
so I came to a conclusion that bariatric surgery.
Uh-huh.
So I looked into option for many options like sleeves, gastric band, and Roux-en-Y surgery. And,
Right.
And suddenly I got something like MGB, Mini Gastric Bypass. It clicked my attention. Then I started researching on that, and that I found only two names in this whole internet world.
Right.
It is one Dr. Rutledge
Right.
and Dr. Kular.
One teacher and one student.
teacher and one student. I found two things
Okay.
only.
Uh-huh.
And then I studied research a lot. 2 years from from 2016. I'm looking into your videos and class you take for patients.
Yes.
Like you and yourself and Dr. Rutledge, he
Right.
takes
Yes, yes.
what to eat, not to eat, and
Right.
all everything.
Right.
So then it was yes, I can go for it because it is really practical. It's practical because you can eat at the same time you can lose weight
Right.
and less chances of complications as it is reversible too.
Yes.
Yes, this is the
So you think the main thing was the reversibility of the procedure?
not reversible. The thing is for you can eat is psychological because if you can't eat you will go in depression.
And okay, tell me now. It has been like 7 days now.
It's 6 days.
Day 6,
Day
and
6.
and that thing has turned out to be
True.
true.
Yep. 100%.
100% true.
100%
that
true.
you can eat
Eat
and
anything you
feel
want.
satisfied.
Satisfied,
And
yes.
there is no nausea and vomiting.
No, at all. No, not
Okay.
a single thing in nausea or vomiting, or I didn't even feel like that it's coming out anything.
Okay. So out of 10, if we have to quantify
Yeah.
the nausea and the vomiting,
Okay.
the feeling of vomiting, is it like 0 or
Nothing.
1
Zero,
or 2?
zero,
or
zero.
Zero.
Nothing.
That's good.
I didn't even feel like
Yeah, this is, when we look around on the internet and try to find out some kind of
Yes.
solution, and we look at the restrictive techniques which would
Yes.
just make your stomach tight.
Yeah.
And when you look into their guidelines that how to eat after surgery,
Ji.
everyone tells you that you have to be on clear
Liquid diet for
liquids
6 weeks.
for at least 6 weeks.
Yeah.
And the reason is that your stomach has gone to be very tight,
Tight.
very small, and we call it as micro pouch,
Okay.
30 ml.
And 30 ml is not even half glass of water.
30 ml capacity you cannot stay on 30
Yes.
ml
Yep,
capacity. Even in our Punjab, if I tell my patients to make their whiskey peg of 30
30
ml,
ml. They cannot.
I can very confidently say that 99 out of 100 will not do it. They make like at least 60 ml,
60.
maybe 100 ml. And then we tell you to take chicken on the top of it.
Not possible.
That's not practically
At
possible.
all.
So that would mean making a small pouch or putting a band on that. Then you will have to definitely change your quality of life. And
Yeah,
if you
yeah.
cannot do that much, then probably you can handle it on your own.
Yeah.
And that is the main problem, and that's what I faced in my initial practice, and that is how we switched to a bigger pouch.
Okay.
And that gives some satisfaction to our patients. But then if you are giving them luxury to eat, then how will they lose weight? Because both the things are ironic.
Parallel, yeah.
So you have to see where is the fault, where is the error. I see many young girls who are eating like just one chapati in one go, very small volume. They are all the times in a dieting mode. Why their weight is like 90 kilos, 100 kilos? That means they are absorbing a lot.
Yep.
That means that's the case. Even water is giving them calories.
Yeah.
So they need a longer bypass so that they should absorb less. So what we do, if you look at the animation of the procedure,
Okay.
in we just have two variables which we can fix with surgery.
Mm-hmm.
If you look at the internet, there are more than 100 different types of procedures.
Mm-hmm.
But scientifically speaking, there are only two things which we can fix. See, this is our system from inside.
Okay.
This is the stomach.
Okay.
And I can make the stomach smaller by stapling. But we need to see how much to do it. It has to be customized according to the
Patient to patient.
Yes. If someone tells me that I am eating like 3 to 4 chapatis in one go, that's like just an average volume.
Normal.
The normal, just like a normal person. Then how much I can bring you down? Because you have to live like a normal person. So that would mean that I need to see how long is your intestine. And you'll be astonished to know that there is a lot of variation in the length of the intestine.
Okay.
So some patients have 35 feet long intestine, but on an average we have 24 to 27 feet long.
Okay.
On an average means I have tried to see the length in more than, I think, 1,000 patients. I have measured the length,
Mm-hmm.
then came on the conclusion that we cannot become God. So we could not devise a formula which would make me the master, so that I should know that doing this much of bypass will give you this much of weight loss. But what we see is that if we go beyond a certain limit,
Uh-huh.
that is a danger zone. Then everything will go down. Your hemoglobin, calcium, vitamins, and everything. So we want to have a good weight loss, but not like we want some nutrition as well. So there is a limit to which I can perform the bypass. So in simple words, like if surgery gives you 80% of result, we should be more than satisfied. 20% we will get on our own.
Okay.
Because if I try to be perfect, perfection is the enemy of
Any
good.
of
Then I have tried all these permutation combinations. If I do a 18 feet bypass, in your case, your weight might come down to 45 kilos.
Okay.
Then we do a reversal.
So how much you did for me, by the way?
In your case, we have given you 220 centimeters, which is like maximum we do is 250.
Okay. So you gave me 220.
Over a period of 13 years, this is what we are still learning.
Okay.
I would give 250 to a 250 kilo man. You are like 178, and I ran your intestine not extraordinarily long.
Okay.
Had it been like 35 feet, then I would have given you 12 feet. So that can change a little bit, the length of the bypass. If your intestine is long, you can get a longer bypass. But for the average length, this is what the best shot which I can give you as per
on
my
the safe, to be on
experience,
safer side.
Being on safer side, but still a very strong shot.
Okay.
There are 99% chances that you'll be a totally changed man.
Okay.
After 1 year, most of the patients would need a new passport.
Okay.
How much you have already lost in
8 kgs in 6 days.
But out of this 8 kilos, initially there's a lot of water which gets out of the
Retention,
body, and don't expect 8 kilos every week, because
every
then
6 days,
nothing will be left behind after 6
definitely.
months, So it will go on its own, and in between it will kind of, it will look like that it has come to a plateau, stopped, but again goes after 15 days. So what eventually will decide where your weight finally goes?
Stabilize.
Where it would stabilize. Number one, what you are eating. So most of the patients would eat like 25% volume, what they were eating before surgery, and that works for good 6-7 months. They're eating 25% of the volume. So that means they will still keep on losing weight, and gradually at about 1 year or sometimes 1.5 years, they will start taking about 50% of the volume, what they used to take.
That's
before surgery.
more than good.
Yes. And that is the time when your weight is going to get stabilized. That's number one luxury with mini gastric bypass, that you can be back to semi-solids very soon. Within 2 days, I think you were taking semi-solids or
Semi-solids, yeah.
mashed kind of things, you
Yeah,
know,
semi-solids.
paste kind of things.
Yeah.
After 6 days, you tried an apple today.
Today I had a whole
you
apple.
could take
yeah.
that
And
because
whole
that apple will gradually go down.
Okay.
It's like a narrow road, but the
Okay.
traffic is moving.
Traffic is moving.
Yes.
Yeah.
So just go slow and chew well.
Okay.
And now you can take roasted chicken, grilled chicken, or even fish or whatever you want, even chapati.
But there is no diet chart as
No
such.
diet charts are not possible to follow for lifelong.
Lifelong,
Not
exactly.
possible. There has been a lot of research on diet charts. We need to know broadly what is good, what is bad. And in your case, we have given you a long bypass, a strong dose of surgery. You should be careful that we want to be thin but not weak.
Not weak. Okay.
And what is it which will give you energy, which will give you strength? It is the proteins. So protein is the building block of the body. It is
Okay.
the cement of the body. So protein requirement, you should not be running into deficit of proteins for the first year at least. So better would be, especially in the first few months of surgery, when you cannot eat, when you're just taking 25% of what you were eating before surgery, you need to be a little bit more cautious that you are taking proteins. And roughly, if you take 1.5 to 2 liters of milk, which is
Okay.
easy to take.
Okay.
If you're not used to whole milk, you can take skimmed milk, you can take buttermilk, or even yogurt or dahi,
Or lassi or
lassi, these things. But don't take like plain water. Take lassi.
Okay.
Don't take juice.
Okay.
Juice is nothing.
Not
It has
going to
got
help
nothing.
you, yeah, nothing.
Yeah. It has got no health.
No help.
So lassi has got health. 200 ml of lassi glass will give you 10 grams of protein. Better than a leg chicken.
Better than a 2 piece of leg chicken.
Yes.
Yeah.
So that's what every day I see. We have been pushing our patients a lot on vitamins and protein products and powders. But what eventually I see is that those patients who are taking natural food,
Are much healthier
they are
than.
much healthier.
Okay.
Like those who are working in the farms and doing some physical labor, they are the best patients.
Okay.
And they are taking, they have their own, cow farm, and they are working in their fields also. So they have natural, milk. 1-2 liters
Pure
for
milk.
them is, they are
Pure
used
milk.
to that.
Yeah.
But the problem with those living in metropolitans is that you are not used to milk.
No, I'm taking my intake of milk
Your
is
milk
good.
intake is good.
Yeah.
If you take milk is a complete diet.
Wholesome food.
Because for good 6 months to the newborn, we don't give anything else.
Yeah.
Not even water.
Yeah.
Just give milk, and the growth will be
They are
all
growing
set,
outside.
normal.
Yeah.
Even the brain, your nerves, your bones, everything will grow normal. So that means milk is a complete diet, because God has given milk for the newborns,
Newborns.
and it's an animal product. We call it vegetarian diet, but actually it's a non-vegetarian diet. So if you are taking milk, you're good. So if you're not in a habit of taking milk, then you'll have to see what to do. You don't have to follow diet charts. Then take, when you're eating, start from the lentil side, dal, sabzi, vegetable, some yogurt or dahi, and then come to chapati or rice.
Okay.
Yeah.
Okay.
So have a thali system.
Thali.
Start from this side.
Reverse side.
Yeah, these broad guidelines should be more than enough.
Okay.
But then every 6 months get your blood work done.
Okay. Fine.
So it should be on your fingertips. What is your protein level, hemoglobin, calcium? So eat small amounts, eat more frequently, and eat healthy.
Okay.
And that's,
Overall,
a simple golden key.
funda of that.
And my duty is to give you a good design.
Okay.
And this surgery is like a very good luxury car, which is easy to drive.
But still, you have to drive.
you have to
drive.